GBS.
Welcome back to the bulletin, and as promised tonight we end with an important conversation on multiple sclerosis, commonly known as MS, and the need for awareness, early diagnosis and support for patients. Joining us live is Isaac Mulwa, CEO of the Multiple Sclerosis Kenya Foundation, and he also battles with this condition. Isaac, thank you so much for joining the bulletin. If you can kindly introduce yourself to the audience.
Well, thank you.
Yes.
My name is Isaac Mulo. I've been battling multiple sclerosis for I don't know how long. I think it's 15 years now, battling the condition still, and I'm managing with it as time goes by. So ideally, one of the reasons as to why I think we are here is to talk about the condition, which is popularly known as the disease for the drunkard people, although we don't take alcohol. Like personally, I never take alcohol. I'm ever sober. Yeah.
In simpler terms to our audience, what exactly is multiple sclerosis? Because it's a mouthful to even say it.
Multiple sclerosis actually to me is a big mouthful because we prefer just calling it MS. MS is quite easy to mention. Well, MS is a chronic medical condition which affects the nervous system of the body, and the body mistakenly attacks the myelin sheath. The myelin sheath is the covering of the nerves, and after it attacks it, as you know, nerves are the ones which make communication to the body. And therefore, if your nerves are attacked and the covering is removed, communication becomes very slow, or rather slower than it should be, hence causing slowness or staggering and such things. It also causes slurred speech.
Okay, so let's shift the focus to your journey on multiple sclerosis, how you actually were diagnosed with it.
Oh, my journey has been interesting. I remember the first diagnosis was 2002, where I was told I have AIDS. Yeah, I was told I could be having AIDS. I was still a small boy, I was still quite young, but I was told I have AIDS. And then later on, and then you see, it was in the hospitals for the countryside, so they never knew exactly what they were telling me. And then later on in 2018, I was told I have a disease for the old people. When I tried questioning, you see, there's this character which you should not ask more about it, you're being told. So when I tried questioning, I was told, that is the condition you have. You have a condition for old people. I asked, what do you mean by a condition for old people?
How old are you by then?
That time I think I was 2018, I was 26.
And what was running through your mind at that moment when you're told you have a disease for the old people?
What was running was that I'm not yet old.
Yes, because you're 26.
Because I was just 26.
Yes.
So when I was told I have a disease for the old people, I asked the guy, the doctor, what do you mean by a disease for the old people? He told me, you just know you have a disease for the old people.
No name.
No name, no nothing. The next thing now, that's when you run to Dr. Google. I quickly rushed to Dr. Google and I started researching what I'm feeling and giving my, I think that time ChatGPT or AI was not very much there. So Dr. Google told me you could be having diabetes. So I go again and test diabetes.
From AIDS to disease for the old people, not to diabetes.
Now it is diabetes. And then now we realize there is no diabetes. Then I got a job in Mombasa. I went to one of the hospitals in Mombasa. And then there I was diagnosed with arthritis.
Now, fourth disease now.
No, that's a fourth one. I was diagnosed with arthritis, and then when I was told I have arthritis, I was given some medication which I was supposed to take for 2 weeks. Then the thing with medication is when you are taking drugs, you should at least be feeling better as time goes by.
Yes.
You should be progressing on quite well. But when I was 1 week into the medication, I realized I am not feeling any better. So I went back to the hospital and I told them, I might not be a doctor, but I am an accountant by profession, by training. I told them I might not be a doctor, but one thing I know is that
The drugs are not working.
the drugs are not working. And also the other thing I know is that the problem is not in my legs. The problem is somewhere in my brain.
In your brain.
Somewhere, I don't know where, but I think it is here. So that doctor was very rude. He told me, we are the ones who know how to do these things.
You cannot teach us our profession.
If we told you you have arthritis, you have arthritis. Then I threw my hands, which is popularly known as kurusha mkono.
Yes.
So I threw my hands and then I said, I look for a way myself. So the next thing was now looking for a doctor who deals with anything neurology. I didn't know what neurology is, but my good doctor Google is the one who told me there is something called neurology. So me, I started looking for a doctor who deals with neurology. I called a friend of mine who was handling my insurance that time. I asked him, where do I go? I am feeling this and this and this. I've gone to this hospital, nothing is forthcoming. He told me, go to neurology center, somewhere in Upper Hill. Just go see any of the neurologists. I asked him, what do they treat? He told me they treat the brain. Because now, when he said neurologist, what came to my mind was a neurosurgeon. And I was like, so they are going to crack my head open and then do their things there. And then that's when I learned there's a difference between a neurologist and a neurosurgeon. So now I went to a neurologist. It's like, you see, people know what they are doing. So that guy, I give a lot of thanks to him. He's called Professor Kwasa. That one I can freely mention. He's called Professor Kwasa. He ordered the right test, because the first thing he told me to get an MRI. No, it was not even an MRI. I had already done a CT scan when I was in Mombasa, and my CT scan was normal. So he told me to get an MRI for the lower lumbar. When I got an MRI for the lower lumbar, now I came back, I brought it to him. He told me, now go back and get another MRI for the brain, so that you can marry the two. So when I got the MRIs, the colors, or rather the pictures, it was like almost every part was white. Almost every part was white. Every part of the MRI was white. And so they decided, no, he told me, you are having multiple sclerosis. After there's somewhere they usually put those photos, and then they look at them and they determine. He told me, you have a very rare medical condition known as multiple sclerosis. And now that was the first day I had the name multiple sclerosis. My first question was, am I dying?
Yes.
That was the very first question I asked him. Am I dying? He told me, no, you shouldn't worry. MS doesn't kill. So when I was told MS doesn't kill, it's only that MS makes your life hard. But it ideally never takes you to the grave. So he explained to me, he told me, now this is how we'll manage it. It will get worse with time, because it has got worse anyway. It will get worse with time, but eventually you will be able to learn how to live with it. And that's when I started managing the condition now, up to date. That was 2022 January. Although now the actual diagnosis started in 2021 July.
From 2016? 2018?
Leave alone those others, I never count them because they were all misdiagnoses. So I only count this actual one. The actual one whereby the doctor who finally told me I have, you see, I never just met him and told me that now you have MS. No, I met him, he told me go get this, I went got it, I brought. I meet him again, go get this, I get it, I bring. So eventually it's when he told me now you have MS. That was 6 months down the line. But cumulatively it has been 15 years, since 2002.
Since 2002. And when you're talking about your journey, for some people, going for various diagnoses is very expensive.
Actually, this is a place where I wish a miracle could happen to many people. I have seen people with the symptoms which I had before diagnosis. You see, there's even the time I went to the hospital, I just tried walking on a straight line. I was unable to. And that's when I decided now I need to go to the hospital. But ideally, it is very expensive to be diagnosed just with MS because MRIs, my time, 2022, it was 30,000. I don't know how much it is now. And then now that is 30. Then many people give up during the misdiagnosis phase. Because now MS now, the other problem with MS is that it's an elimination diagnosis condition, whereby you are diagnosed with one. Now they first test one, they don't find it.
They don't find it. They
So
test
they
another.
put that aside. They go to another one, they don't find it. They put that aside. There's no a specific way of now testing for MS. At least up to now it is not there. But if it was there, it would be better. But if you see, if you have the money, once you test the first time and it is not there, it will be easier for you to go back and test again. But if you don't have the money, once you test the first time and you don't know, you are told it is not that one, what do? You give up.
You give up, you just live with it.
And then once you give up, you are there living staggering. When we meet you on the road, we say, this guy is drunk. Very drunk. Actually, today I was having a conversation with a certain guy. We live in the same plot, and it was like, Isaac, are there times you're usually drunk? And I was like, me, I don't take alcohol. He told me there are some times whereby you look very, very weak. And I was like, mostly in the evenings. I think with time I've also learned how to live. I know mornings I'm very strong, but evenings I'm very useless also. Because now you're weak, you can't move around. Thank God I am still single, I'm not married. If I was, it would be another story. For me, diagnosis takes a lot of money. Leave alone diagnosis, even management is expensive. And that's where I come in. I don't know how this will be taken. For me, SHA works.
The Taifa Care?
SHA. I don't know SHA. SHA, your Social Health Authority.
Yes.
Your government. It works for me because it is able to cover the management drug, which I actually take every 7 months, and it covers 100%. So for me, it works. Maybe for another person, it doesn't work. But for me, it works because I have a structured medication which I take. And that's why even during times of deliberation, we were deliberating chronic treatments, we brought down. And they were surely brought down. They are down. They are honestly down.
Okay, let's talk about your foundation.
Now, as you can see, I'm wearing an orange shirt.
Yes.
Orange means multiple sclerosis awareness. It's the color for awareness. And this is global. It's not just here in Kenya. It is not just for Multiple Sclerosis Kenya Foundation, MSKF. It is not just for us. It is global. And that's why you find that all MS organizations in the world, that is ours in Kenya, we have another one in Namibia, another one in South Africa, there's one in Nigeria. Yeah, that's all. In Africa, MS is under researched and under diagnosed also. So talking about MSKF, we are targeting early diagnosis. We're also targeting awareness creation. We're also targeting advocacy. And we're also targeting financial support. We provide financial support to other patients of MS because, as I told you earlier on, MS is expensive to manage. And it being expensive, there is that person in, now which city in Kenya do I say? I'm looking for Kakamega, a western city, Kakamega. Yeah, they say there's that person in Kakamega or Busia, or even Ukambani, where I come from, who is sick but cannot afford medication.
The medication, yes.
So now we are supporting such people because they cannot afford. That person is just looking forward to getting to KNH. But now the drug is 400,000. How will he afford? He can't afford.
We can't.
He has to stay at home. So now that's where the foundation comes in now, to just manage, or rather to just support this financial, to cross this financial space which is in between the patient and the management drugs. And also you find that in most cases, like for me, when I was diagnosed and when the disease progressed, I was formerly employed. Now I am no longer employed. So you have no money. Because the disease has incapacitated you. And then you've graduated to a person with disabilities. And then after graduating to a PWD, now you have the disease, you have to manage it, you have to know what to do, you have to, it's a whole lot of things.
So an MS patient can apply as a disability person?
Yeah, it's allowed. It's allowed. It's allowed. When you go to the portal, we were also, when the foundation was formed, we were also part of the group which, for lack of a better word, fought to bring disability registration on, like, because we realized we can't keep on going to the district disability office.
Every time.
It is tedious in one or the other. Like someone like me, nowadays, I would rather just remain in the house than go anywhere else. If I have to go, I ask myself, what if I don't go? Will it burn? And you see now that is another challenge, a whole new challenge of PWDs. It is usually very tricky, as well as very expensive to move around. So MS people have progressive medical conditions, and one of them is MS, as well as others, arthritis, ALS. ALS is amyotrophic, but still a cousin of MS. There's also, I don't know, the other sclerosis which is there, but there are a couple of sclerosis. There's scoliosis, there's NMO, that is neuromodalitis disorder. So there are many.
And
so we qualify.
So, and the foundation, is it under the Ministry of Health?
You see, the foundation, we registered as MS patients. So we work with the ministry. We cannot be under. There's no any non-governmental organization under. We just work with. We work with the ministry to ensure that MS patients, because we came to discover MS is there in Kenya. MS is present in Kenya, only that there has been no diagnosis in Kenya. So we work with the ministry We work with the government, although not fully as we would wish to, because still MS, as I've told you, there's a lot of misconceptions. And then we're in Africa, and I think Africa is our business. There's also a lot of lack of concern, dismissal of things, negligence in Africa, and that's what we are calling upon people to stop doing.
I was going through online today trying to find one even patient of multiple sclerosis, and I couldn't find. There are not many patients out there, or patients who have come out like saying I have MS.
You see, as I told you, MS is underdiagnosed. It is there, but not diagnosed. Most patients are not like Isaac. Isaac is outspoken. He will talk about it. And once he talks about it, someone else will hear. But now bring someone like Carol, let's say Carol now. Carol will be diagnosed, and then most of the patients usually give up. After diagnosis, I don't know the best words to use, but they kind of give up with life. They call back to the countryside where there is no internet. And then the misconception that umerogo, you've been bewitched. There is witchcraft. That misconception also has affected many people. So in as much as you've not seen, but now, since it is under researched, we are promoting research on MS, because it is no longer Western person's disease. You see, previously MS was known as a disease for the Mzungu.
The Western people.
Yeah. That is previously. But now we've come to learn, if people like Isaac already have MS, it means that MS is existing in one or the other. It is here. So we have to deal with it. We're also saying the reason as to why me, when I was diagnosed, I tried. Actually, today it's better when you write multiple sclerosis. At least you'll see mskenya.org. That is our website. But when I was diagnosed, I tried writing multiple sclerosis in Kenya. And the only thing I could say was multiple sclerosis, United States.
So even on Twitter, there is not like really conversation about it, much conversation about it.
And that is the conversation we are trying to push now, because we want people to talk about MS, because it is here. It is living with us. I have seen, as I told you, I have seen many people who have almost the exact symptoms which I started with. When I started, my speech was not slurred, but nowadays it is. When I started, my staggering was not as much as it is now. When I started, I could just walk normally, but maybe not in a straight line, but I could just walk normally. So ideally, the reasons as to why I can say you've not seen any is because we still require support in that sector. And that's why, by the way, we are calling upon partners, governments, professional people, that is neuros or other doctors, general practitioners who know about MS. And we're also calling upon insurances, because you find that when you go to these insurances in Kenya, they don't insure people with MS currently, because they consider us to be risky. But we are calling upon them. We are also calling upon other partners. We have a couple of them, and we are calling for more, because it will be very good for us to achieve the goals which you have. And as you can see, we are not only dealing with Kenya. We are dealing with the entire Africa. At least the white person knows about MS, but the black one knows nothing about MS. So we are calling upon people to come partner with us.
And if you can tell us about the statistics, if there is any, about people in Kenya actually living with MS right now?
Actually, according to the data which we have we start with the world, then we downgrade to Kenya. There's a major partner which we have called Multiple Sclerosis International Federation. That is MSAAC. We are a member body there. We have more than 4 million people in the world with MS. And now narrowing down to Kenya, and now those are the ones who have been diagnosed, who have been tested, and they know what they are suffering from is MS. But since MS is still under researched and diagnosed, the numbers are potentially more than that. Like now in the world, if we talk about 4 million, there is a possibility of having even 10 million. And now coming to Kenya, there are roughly around, let's say, 100,000 people with MS who have been diagnosed. They are less than 1,000, unfortunately, because of the diagnosis hiccups. As I was telling you, when you are diagnosed with the first condition and you lack money,
You cannot
chances
go
are
through
very high
that
you will not
process.
continue. So, and that's where the foundation comes in. If you suspect you might be having MS, come to us. We will take you through. Even if it means sponsoring you, we'll sponsor you to test, because we ideally are aware of what to test for, because we studied and realized through the data which we had, the people who have been diagnosed, they technically have, as in they have technically gone through the same things. So we, after studying that and after understanding that, we were very happy, and now we are sponsoring people left, right, and center. Right now, I think we have sponsored more than 70 people. For diagnosis alone, I think it's around 30. Then medicine, that is management, because ideally there is no cure up to date. Management, we have more than 40 people. But we still require your people support.
And let's talk about MS as a disease. Is it hereditary? Can it be passed on?
According to the current research, it is not hereditary. Actually, nobody, even the world, nobody knows where MS comes from, because it is not hereditary. It is just something which develops from we don't know where. It is not about the food you eat, because now mine started when I was still small. It's not about injuries. Me, I've never got an injury. I never got before I was diagnosed. Although after I was diagnosed, I have fallen down several times. Yeah.
So anyone can get MS?
Anyone, even you.
Even me.
Yeah.
So let's talk, at an early age, if a child is diagnosed with multiple sclerosis, isn't there like a stigma to it? Or even you right now, do you face stigma in the society?
Me, I think I'm used to stigma. But there's a lot of stigma after diagnosis. See, now I usually say it's not the disease which someone is ailing from which is harmful. It's the knowledge of that you are suffering from a certain disease. So I usually imagine if a child knows.
Yes.
Like, I have a friend of mine who was diagnosed. That friend of mine was diagnosed when he was 12. After he was diagnosed, it never took long before he went to the wheelchair. Because it affects you in the brain. You start feeling pity for yourself. And as I told you, I thank God I am a strong person, because I never let it put me down. I would rather put it down rather than it putting me down. Then once you are diagnosed, there is that stigma which comes to you, and then people start telling you, "Oh, you have this. You're almost dying." But the truth is, you're not dying. But
It just makes your life hard.
It just makes your life in a way hard. But one thing which encourages us, and one thing which we preach in the foundation, is that MS does not kill. But MS-related complications kill. And what are these complications? As you see, when I was walking in, I never saw the TV there. So I almost did it with my head. So that is an MS-related complication. Let's say I'm walking along the road, then I stagger and fall into the road. And then coincidentally, a lorry was coming. It goes over me. That is another complication which has killed me. But MS itself never kills. You can live, according to statistics, and this one, anyone can refer to MSAAC website, even our website, mskenya.org. You can refer to the websites statistically. People can live for more than 70 years after diagnosis. Yeah.
But it becomes more hard living.
It becomes more complicated.
More complicated.
I think that's something we are, in one way or the other, used to.
So,
Because once you know there are things you can do, and the others you can do, you just find a good way of doing the ones you can do. The ones you can do, you block them.
you block them.
And that's why in MS we say also positivity all the way. We never promote negativity. Because we realized once I tell you you are incapable of doing a certain thing, that is the beginning of your end. Yeah.
So, a minute for your closing remarks, what you can say to anyone out there who's currently suffering or maybe has the symptoms of MS.
That could,
Okay.
what I can say is that MS is here. MS is very active with us, and many people are suffering from MS. And ideally, we are calling upon governments. We are also calling upon professionals, that is insurances, also medical professionals. We are calling upon them. We are calling upon other partners, especially transport logistics companies. We are calling upon them to come and support the foundation, because we have a good cause. We are running a cause which is supporting people with MS positively. And we are also calling upon individuals to support us either financially, through donations, or rather in kind. We could be very happy. And by the way, we have a, can I say our pay bill?
Yes, go ahead.
Oh, we have our pay bill. Our principal banker is NCPM. And the pay bill is 880-100. 880-100. Then the account number is 15 times and then 0. 15 times then 0. And then if you're out there and now, this way I give myself as a living sacrifice. I can give my, am I allowed to give my phone number?
Go ahead.
I can give my phone number where, well, me, I'm just the chairman, but we can show you what to do. The phone number is 0706 001 765. 0706 001 765. So come down and support us. Come down and merge efforts with us. We'll be happy. Also, we have our NCPA bank account, although that is a pay bill. If you need more, you can talk to us. We have our website, that is www.mskenya.org, and our email is info@mskenya.org. Yeah.
Thank you so much for gracing us and for creating awareness on this rare disease that is actually affecting more of Kenyans right now. Yes, and with that, you've come to the end of the news bulletin. It's always a pleasure having you on board. My name is Susan Nganga, and our sign language interpreter tonight has been Paul Mathenge. Have a good night.